we want to try and explain what a stroke is. So a stroke is sometimes called a brain attack. So your brain, this is a brain, not a real one obviously. Your brain is like your body's computer, it's your control centre. It controls absolutely everything that you do, your thinking, your thought processes. And in order for your brain to function, like all the organs of the body, it needs a constant supply of blood, because the blood carries the vital nutrients and the oxygen to the brain cells. Now, when a stroke happens, it happens because somewhere in the blood supply there's been a blockage or a bleed. So part of the brain's blood supply has been cut off, and that means that the cells become damaged or they die. So there's two main reasons that a stroke happens. If you imagine your brain sliced in two, so this is an infarct. You see the red there is your blood vessels. This is your blood going to different parts of the brain. And sometimes a clot forms and it gets stuck. It travels around the blood vessels until it gets stuck and causes a blockage. So all this grey shaded area there represents dead brain, basically, damaged brain. This is a clot, one type of stroke. Sometimes the clot happens itself in the artery, and that's called a thrombus. But sometimes it originates somewhere else in the body. So, for example, you might have somebody who has had a fall, perhaps fractured their hip, goes into a hospital for a routine hip replacement, and then due to the surgery, sometimes a clot can form and the clot might travel around. If it gets stuck in your heart, you have a heart attack, but if it gets stuck in your brain, it's a brain attack, it's a stroke. So that's the first type of stroke. That's actually the most common type of stroke. The second type is a hemorrhage, it's a bleed. That's where the blood vessel, rather than having a clot, it's burst and it's bled, all the blood is bled out into the brain. Now this happens when the pressure in your artery is too high. So the blood's pumping away at too high a volume, the artery can't cope with it and it bursts. It's a bit like if you have a garden tap with your hose pipe on, you turn it on too fast and it pushes your hose pipe off and you get soaked. It's a bit like that. So it's either due to blood pressure, which is one of the reasons why it's quite important to monitor blood pressure. And if someone has high blood pressure, then they're often put on medication to try and keep it stable. Sometimes people don't, they're not known to have high blood pressure, but they've just got a weakness in the artery wall. It's just one of those things.